Are there specific brain nutrients that we need as we age and we have age-related cognitive decline, that kind of thing? Are there some that we could be using?
Oh yeah, definitely. Yeah. L-carnitine or acetyl L-carnitine is a very important one for brain health. That improves everything, but apparently especially useful for memory. Phosphatidylserine
That one, yes.
is one that's important. Of course, the fish oil. I mean, age-related cognitive decline is probably accumulative malnutrition or
Really?
exposure to toxins such as psychotropic drugs that may be what's happening for years before that. An interesting example was a physician who found out that his mother, age 60, had like 30% shrinkage of her brain. And she was always in good shape. She ate well, she exercised, she was in tip-top condition. The only risk factor that doctor could think of was that she took every prescription drug her doctor recommended. She took Valium and she took Prozac and she took all these drugs. And that was the only thing that in that mother's history that could have accounted for the Alzheimer's. So she had Alzheimer's, was atrophy of her brain. So we know that these are toxic substances and neurotoxic drugs. And who knows, maybe she was eating NutraSweet and Splenda and a whole bunch of other MSGs, which is all toxins. So what we need to do is the long-term prevention. We need to avoid all the things that can lead to that. And of course, the industry doesn't think there's any, they don't try to figure out what the causes of it are. They just say, oh, it's there. Maybe it's these abnormal proteins. Maybe, you know, they do all this research.
Inflammation.
Yeah, inflammation. They don't want to
That's
admit.
not vague, is it?
That's right. That's pretty vague. Yeah. Parkinson's disease, for instance, is highly correlated with pesticide exposure. So farmers that use pesticides and herbicides and are exposed to these poisons are very highly prone to getting Parkinson's disease. Well, Parkinson's disease, anybody will get if the substantia nigra, one of the little nuclei, little teeny nuclei in the brain, when 80% of the nerves are destroyed there, and with age, you know, we knock off some, 80%, and everybody gets Parkinson's disease. You know, the expressionless face and the tremor and the stooped gait and depression is common with them. Nightmares are common. Well, the correlation there is with solvents. Solvents are the other one. You know, if you're that dissolves fat. Solvents dissolve fat. So if you're exposed to gasoline fumes or benzene or pesticides and herbicides, you're probably at high risk of getting a degenerative disease such as Parkinson's or Alzheimer's, etc. So so by then, can we reverse it?
Right.
No. When brain cells die, they're gone. You know, you do not reproduce brain cells. Brain cells do not reproduce themselves, so they can't regenerate. The surviving ones, or the ones that are just wounded, near death, maybe can be revived. And so I never say you can't revive them. So maybe the remaining ones that aren't dead yet, they're just on death's door. Maybe they can be revived with appropriate nutritional supplements. So that's where we then use the antioxidants. I would give a person with cognitive decline N-acetylcysteine, which is the precursor for glutathione, and the brain and the liver need lots of glutathione to kill off toxic substances, and lots of fish oil. And then I would use the amino acids that are useful in memory and acuity, such as serotonin, or the precursors of serotonin,
Such as?
such as 5-HTP,
Okay.
5-hydroxytryptophan, or tryptophan. And I would use tyrosine, which is a precursor of dopamine, and norepinephrine, which are help with acuity and memory and things like that. And then just avoid anything that might possibly be a toxic substance. So the food needs to be cleaned up too. And of course, nursing homes or most institutions buy pretty cheap food. They buy it from the cheapest supplier. It's probably not organic, and it may have pesticides and herbicides that may make things worse. And of course, in nursing homes, if little old ladies are a little agitated, right away they get Risperdal, or they get some antipsychotic drug, which is also neurotoxic. So the food supply and then the ease with which elderly people get on medications is probably going to make them worse in some ways.
That's depressing, but thank you for the information.
You're welcome.
All right.